a man and a woman arrived in Chernivtsi region after a trip to Italy. At the entrance to Ukraine have checked the temperature, but symptoms at first, was not. They were at home in isolation, when 29th of February is already having symptoms similar to the coronavirus. The case, coronavirus, ed, registered in Ukraine. We started working with contact persons. Contact persons a bit, said Mr. Larashko in the briefing. People followed the advice, after returning from Italy were in isolation and had not met with their loved ones. They were similar in his apartment, said Mr. Larashko. The state Korobavo, stable. It was not to hospitalize, to provide medical help at home. But this is the first time, and our task is to prevent transmission of the virus in Ukraine, said the deputy minister. The map is based on periodic data releases by the WHO and may not display the latest information from specific countries. The epicenter of the spread of the disease has become the Chinese city of Wuhan. From there the virus had spread worldwide. It already is in the United States, Iran, Japan, reached Europe. Coronavirus or not, doctors symptomatic treatment. As in the case of other acute respiratory viral infections. Flu-like infections for example. Can't say that for the coronavirus of some special measures, said the Deputy Minister of Health Victor Larashko in an interview Pound. UA. The most common symptoms of coronavirus is high temperature, fatigue and dry cough. Some patients may experience aching muscles and joints, runny nose, sore throat or diarrhea. 1 in 6 infected with coronavirus may have serious complications, the most common is pneumonia. At risk older people, health workers, people who have chronic diseases. According to preliminary calculations of scientists, dies from the disease about 2% of patients. Most of the victims of the coronavirus now recorded in China's Hubei province. There is the highest mortality rate of 2.9%. According to Ministry of Health in Ukraine there are 30 sets of chemicals for testing COVID-19. The kits contain approximately 3,000 responses, which is enough for the study of more than 950 people by the polymerase chain reaction. The WHO has published recommendations on how to reduce the risk of infection with the new virus, regularly and carefully to wash hands, not to touch your face, not to eat bad processed meat, milk and eggs. To refrain from traveling to regions where there is a spread of the virus, avoid contact with sick people. Stay at a distance of over a meter with any person who sneezes or coughs. To comply with cough hygiene,